we've got quite an extensive research project going on with different levels. We're doing, for example, a lot of EEG studies on adults with ADHD, and we're definitely picking up differences in brain patterns and things like that. But we're also looking at other aspects of ADHD. For example, career choice, how people cope with careers with this disorder. We'll be looking at creativity at some point in time. We've looked at diagnostic assessments. What is the most effective way of diagnosing this disorder? Any psychiatric disorder, or with most psychiatric disorders, there are standard procedures to arrive at the diagnosis. We've not reached that point with ADHD yet. The list of characteristics of ADHD is actually quite endless. Okay, ADHD people tend to have difficulty staying in the same job for a long period of time. Okay, especially if the environment is a boring one. Okay. In terms of the full-scale IQ, your IQ, there's no difference between ADHD and non-ADHD in terms of IQ. Okay? ADHD does not affect intelligence. What we found is that ADHD people don't necessarily seek out novel situations. Okay? So it's not as though we want to go out and do something differently. We can kind of cope with our environment. However, there needs to be intensity in the environment. So it doesn't have to be new, as long as what you're doing stimulates you. The treatment for ADHD must be holistic. Medication only is not going to change a lot of these things. Okay? The medication will help to mediate, to control some symptoms, basic symptoms like impulse control, sustained attention, things like that. It is, however, not going to address your interpersonal problems. Okay? It is not going to address your inability to stick to deadlines. It's not going to make your organization better. So the medication will enable you to learn new skills and things. Okay? But the treatment must be holistic. There must be room for medication and for other forms of therapy. Okay? That's it.
Fantastic.